Some of the procedures that we utilize in the therapy room for acquired brain injury or other neurological conditions will be focused on the main diagnoses that we see in this population. So one of the things is going to be working on eye teaming. One of our most common procedures is Vectograms. And this is where we're able to use polarized targets while the patient's wearing the polarized glasses. And we manipulate the targets and it will make them look like they're moving closer or farther to the patient. So we're working on what's called convergence or divergence of the eyes. One of the other common diagnoses we see is difficulty with accommodative or focusing system. So one of the common things we use here are plus or minus lenses, and plus or minus lenses will either magnify or minify the image. So in these cases, we have the patient going back and forth, and this is stimulating or relaxing the focusing muscle. We'll work a lot on ocular motility, which is the eye movements. And in these cases, we'll have the patient doing pegboard. In the beginning, the pegboard may start stationary, where the patient is working to insert the pegs into the holes without hitting the board. And then as they get better, we may turn the pegboard on to where it's now rotating while they're performing the procedure. One of the other big things that we work on is central peripheral integration. And in this case, we may utilize a procedure such as this, where the patient is doing a 4-chart fixation. So they're reading the rows of letters on the 4 charts. And as they're going along, the therapist may call out a different color, and they have to see that in their periphery and tap that color. So they may be reading the bottom row, DTCHE, and the therapist yells out red, and they have to tap the red circle and keep going.